everyone, my name is Marte and I am HR officer and part-timer TV commercial model. Actually, I am a CSA baby since 2013, I guess, and yun, siya talaga, si Doc Tessa talaga yung nag-aalaga sa akin. Ayun, my main concern since I am a part-time TV commercial model, so laging nakaharap din sa camera, so ang aking main prob is yung mga lines and wrinkles. So I think sign of aging. I'm so excited kung anong gagawin sa akin ni Doc, and don't forget to like and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's welcome Mr. Marte Katakutan. Welcome back, Marte!
Hello everyone, and it is nice to be back here.
I know, it's been 10 years. You were 21 then, now you are plus 10.
31.
But he still is young looking and good looking. What's your secret?
Dasal-dasal.
Amen to that. That's very important. Number one yun, right? Plus healthy lifestyle.
Yes, of course.
Yun. So, parang hindi po nag-age. But then I was doing an assessment a while ago on the upper third of the face. And I'm seeing some lines and wrinkles. Yan. Siyempre, 31 na eh. Yan. So, aging actually starts at 25 right now. So, our collagen and elastin in our skin dermis will start to get depleted by age 25 na daw. And yearly, you are reducing all these skin fibrous proteins. So, gradually, you're seeing lines, wrinkles, and when it comes to lines and wrinkles, there are two types, dynamic and static. So, si Marte, I'm seeing both. Okay. So, there is this dynamic wrinkle whereby when you move the muscle, when you contract the muscle, you will see the wrinkle. While static, when you don't move it, when you don't do facial expression, you already see a line. Yan. So, I noticed here yung tinatawag na onse. So, it's still a superficial static line, still in the mild category. Ayan. Mild category pa lang. Because we have others with very severe type of static wrinkles, yung mga talagang dented na, or it's like a furrow already. Yan. That's one. And then I noticed also on the corner of the eye, yung tinatawag na crow's feet. When you smile, you will see those lines. Okay? So, upper third pa lang yun. Now, mid-face, lower face. In the mid-face, I'm noticing a good cheek curve, a good projection. And then, ganda ng skin. Yan, alagang skin. Alagang-alaga.
Alagang CSA.
Alagang-alaga ng batang to. At may nag-aalaga, I think. Yan. Then, when it comes to the lower face, okay. So, actually for men, we want this good jawline. So, if you look at the corner, this part, the angle. Yan. Medyo, there's already a beginning reduction in that angle. So, it's starting to become yung blunt angle. It's no longer the 90-degree angle or yung sharp right angle. So, we want to somehow improve this. Plus this one. Yan. Nag-gain ng weight. Malakas kumain. Yan. So, we also wanna get rid of this, the under chin, the bulge there. What kind of procedure, what treatment to target those, of course, dynamic wrinkle and static wrinkle, and at the same time, also create this jawline, like an L-shaped jawline. What procedure, what treatment, we'll show you when we return. And we're back. So we're with Marte, and I'm checking on his skin, and particularly on the forehead region. Marte, this part here. Once, the 11. Okay, and I'm seeing already like a superficial static line here. And actually, I was asking Marte a while ago, like, if he is concerned about this medial brow area. It's kind of like downwards, or could we say, like it's starting to droop down. Okay, so there's a treatment whereby we don't use the Botox, but we use some lifting material to pull this upward like that, and at the same time target this 11, this static line. And we want you to have a very good like shape of the eyebrow. Yan, especially for men. Actually, for men, it's more acceptable to have kind of like a straight one, you know, rather than the arched one. For men daw, Mark. Okay? And there's a personality being depicted when you have like a straight eyebrow. Parang professional daw ang dating. Yun, especially for men. So, we kind of wanna lift this also, and at the same time, treat already this static line that you have, okay? And later on, we'll also work on the sides, the crow's feet. We also want to use, of course, there will be a treatment still with Botox, because dynamic wrinkles, primary treatment, Botox. Now, for static wrinkle, it can be either filler, or right now we have the so-called volumizing threads, or you can use both. Okay, and we'll also work on the sides of the face plus the jawline area, and get rid of the double chin. Yan, natawa na si Mark. Okay, so I'll start with this area here. So a while ago, we cleansed the skin and we also applied topical numbing cream. So right now, I'll be doing another injection of, rather, another anesthesia. Okay. Anesthesia injection, okay? Before that, we also have a spray called the pain freeze, okay? Spray on the area that we will work on. So this will further help in numbing the skin, okay? So after that, I can inject a lidocaine on a so-called entry point. So for Mart, I will be doing a combination thread lifting plus filler. So for this part, the one with the static line, I'll be using a protein thread or a collagen biostimulator thread or a volumizing thread. At the same time, a lifting thread, and the thread that I'll be using is the so-called multiple bidirectional cog thread or Newton cog. So, narinig mo na ba yung Newton cog? Di ba?
Hindi ba? Okay.
Okay. So, we'll also explain that later on, what's Newton cog. Okay. Well, there's this like product material we call like a multiple bidirectional cog, and that one is, it has a brand name, so they called it NCOG or Newton cog. I'm just gonna glide this. Okay, let me know if like you feel only some pressure there. Okay, okay lang. Okay. So I'm just gonna be gentle because I didn't inject any more lidocaine in the skin tissue layer up to the brow area here. Okay, let me know how you're feeling. Okay, just be gentle. Then once we reach the end point, the so-called hanging point, then we're going to pull it out. And another one here. So I'm using a Newton multi-cog or multiple bidirectional cog and just directing it in the deep plane. So we want to anchor it also in the so-called ligament here, the orbital retaining ligament. Some pressure, okay? Some pressure. Because I didn't do any more nerve block, so-called supraorbital supratrochlear nerve block. Okay, that's it. So we're just gonna pull that up and then cut it with this iris scissor, and I can still combine it with my botulinum toxin. So I will inject the so-called Procerus here, Procerus there with a 4 unit, and then inject the left corrugator with a 2 unit, and the right corrugator with another 2 unit, and the tail of the corrugator 1 unit, and 1 unit for the other tail of the corrugator. There you go. So we did the upper third. Now let's go on the lateral part of the eye. So when you smile, so we see those lines. Now I have another like material that I use for correcting this so-called crow's feet here, especially those with static wrinkle here already. Actually, I'm seeing a beginning static wrinkle already. So we can use a so-called dermaspring eye thread for the lateral aspect of the eye. So I need a lidocaine for the entry point. So entry point can be here, and then we need something to poke the entry point. And I'll just be using a so-called Derma Spring PDO type of a thread. And this is loaded in a cannula. So this is gauge 29, 40 millimeter, and just pull it out. And in a fanning method, just apply it. So this will stimulate collagen formation. Okay, still good. Yeah. It has a collagen stimulation at the same time fibroblast activation. So this PDO or polymer type will help in regenerating and rejuvenating the skin, tighten and firm, and at the same time a lifting benefit as well. Okay. So if you want a longer lasting result, you can combine with this type of Derma Spring. Like if you have Botox, the effect is lasting only like around max is, well, some it only lasts 4 months, the others they said 6 months. So case to case basis. There you go. So we've done the corner. We'll also add like a botulinum toxin to treat the dynamic wrinkle there. So you can give a 2 and a 2 and a 2. Okay. So it's like a 2, 2, 2 using a 100 unit vial of botulinum toxin. Now we'll work on this side of the face. Here you go. Turn to the left, please, Mark. So I'll be using another multiple bidirectional cog thread. Okay, so this part is our entry point. So following the tail of the brow there, this is gonna be my entry point. Just a lidocaine. So Mark has a very high tolerance. So this is just lidocaine, Mark, okay? So we're just injecting it into the periphery of the face. We wanted to create the so-called L shape. Sorry. I'm just gonna create an entry point here. So be careful with the superficial temporal artery in this section here. It's located in the fascia, the superficial temporal fascia. So we start with the superficial fatty layer or layer 2 in this part, and just do a vertical vector there, just a straight line. You can use 1, and you can even add more. You can make it 2 or 3 in a parallel manner. Okay. We're just gonna reach that mandible there, the angle there. So just gonna glide in the soft tissue layer and we pull up. Now let's create that good jawline here. So we want to make it letter L. So follow your mandibular line here, and when you're at the angle of the mandible, you can make your entry point at this part here and just inject your lidocaine in that soft tissue layer. So basically what we're targeting is the fatty layer. It's the fatty layer that usually droops down or sags down. So we can use like a sterile OS here and just glide it in that layer 2 subcutaneous layer. Okay. And reach that ligament here. We have some ligament also here. There you go. And this is to create that good letter L. So another one. So we'll add a second cog thread for this jawline area. So for my patients who wanted to create a good jawline, a defined jawline, this is another way to do that. You can also add some filler on the angle of the mandible. You can inject also a high molecular weight filler to create that good angle of the mandible. But right now we want to reduce filler use because of the so-called overfilled syndrome or pillow face. So we don't want to create a pillow face because Mart already has a round face, so we want his face to become more of the masculine type. Okay, so we have already this multiple bidirectional Newton cog. We call it the Newton cog thread. And after this, we'll also do the so-called under chin mesotherapy. Okay. And cut this one too. And we'll just proceed with the under chin. Now the mesolipolytic solution that I use is so-called MNUS, and it contains natural substances that's gonna help in dissolving the fat tissues. Okay, so we spray with that. So make sure there's a frosting to really have that good numbing effect. So crossing this one here. There you go. So we'll just do like an injection in the subcutaneous fat layer there and do a fanning technique. So you can use 2 ml for this under chin to about, it depends on how, like the size of the bulge is. So you can use more than that. And then let's proceed to the left side. So we have done the treatment for Marte. We'll show the result when we return. And we're back. So let's show the result to Marte. Here you go. The mirror. Yan. So we did treatment on the mid glabella area. We combined with those Newton cog, the short one, plus also botulinum toxin. And also on the crow's feet, a combination of derma spring thread and your botulinum toxin. And we did use the Newton cog here and also on the jawline and the melting of the fats here in the under chin. So for now, it's kind of like not really that obvious, but actually I've noticed already in the dent on the static line on your glabella, there was already an elevation. So that one you've seen an instant result. Now, the PDO threads, they gradually stimulate collagen formation from the 4th week to the 12th week. So you're still regenerating from inside and you just gradually see the result on the outside. Okay, now the fat dissolve, we give time for the effect like 2 weeks to 4 weeks. Then after 4 weeks, you come back and we'll evaluate again if we need another session of that one. Plus, of course, we need to combine it with diet. There you go. And another thing I'm seeing, Marte, is like a while ago, I've noticed the mid-face and this part here, the jowl fats here, they're also prominent, okay? So we want to also next time reduce this jowl fats here. And then I was mentioning to Marte, like the under eye area, there's a beginning volume loss already. Don't wait for it to become severe. So the moment you start some signs of aging already, you have to treat it right away. So from a mild one, treat it right away. Don't wait for it to become severe because you'll need more treatments when problem becomes more severe because there's like an accelerated aging process and then some damages in the skin dermis will just progress and the problem will become worse and you'll need more treatments for that one. And aging is a complex process. It's multi-layered aging. It's not just on the outside. It's not just the skin, but also on the inside. The bone layer, the soft tissues, the fats, the muscles, the ligaments, and others, right? It's now rejuvenation. You treat right away. Huwag mo na daw hintayin lumala. Huwag mo na hintayin na lumawlaw ng lumawlaw ang mukha or lumalim ng lumalim ang wrinkles, maging severe kasi when you say kasi static wrinkle, it means permanent. Ano na siya? Yun na yun, static. And kasi parang may napunit na sa skin, yung sa mga static wrinkle. It's like a scar already. So, di ba, you always frown. Tapos, your muscle pulls down your skin. So, every day yan. Ilang beses sa isang araw kang galit. So, the constant like movement of the muscles and pulling of the skin inward, there's like in the skin dermis, may napupunit. Yung mga fibrous proteins, yung mga collagen, elastin, these are like para silang mga, anong tawag natin doon, mga kable or mga rope na syempre pag constant ang tension, no? So, pwedeng napuputol-putol na yan. So, when there's already like a ripping or a breaking of those collagen fibrous proteins or strands, yun na, parang scar na yon. So there's a break in the dermis. And ang treatment na nun, hindi na lang po botulinum toxin. It's gonna need dermal filler, it's gonna need PDO threads, and even mga lasers or energy-based devices. Because we have patients, pag pumunta, may wrinkles. Ang wrinkle nila, hindi lang dynamic. They also have the static. They're expecting with the Botox that it's gonna go away, that the static line will be totally gone. So, hindi po. So, for our patients who are expecting that the Botox treatment for static, na it will be gone, it's not like that po. That's why we advise, wag nyo na pong hintayin maging static wrinkle. Treat it right away po. Yan. So, if you're seeing already like a beginning indentation there, yon. You go to your aesthetic doctor na po. Right? So, how was it? How was the experience so far?
So far, okay po, Doc. Kasi hindi masyadong masakit.
Yeah.
And
tolerable, manageable.
Tsaka ang bilis ng procedure.
Yes,
And
exactly.
instant result din.
Right. And considering Marte po kasi is a busy person and stressful po ang job. Human resource, right? Yan. Yun. Yung workload, it's not an easy workload. Yan. So, ang hirap mong mag-set ng schedule with us. That's why we need a treatment na somehow procedure is quick and he could see some results already and the experience will be just okay and the pain manageable, tolerable, yun na yun. Right? Yan. And no downtime as much as possible.
Ayun,
So we don't
maganda.
want any bruise or like yung
Swelling
face mo talagang parang blown face. So we still want you to do your job later on. Baka may mga ka-meeting, yan. So these are treatments, procedures that you can do if you're busy, like a lunchtime treatment and no need for a long downtime. This will be best for you. But of course, also research the injector, your doctor who's doing the treatment. Make sure that they are well-trained and certified to do these kinds of treatment. Thank you, Marte.
Thank you so much po. Thank you.
So we'll still have a follow-up. And again, let's continue your journey. Journey with CSA. Yan. Thank you, Marte. We'll see you again. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our Instagram, CSA Medical Aesthetics, FB, CSA Medical Aesthetics. Marte, pwede ko pa nilang i-follow kung okay ka lang.
You can follow me on Instagram at Marte Katapulan.
Yan. And our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-8609190 or 0917-5044268. And please do watch our other videos. I think yung sayo, matagal na. Okay? So just look at our channel, YouTube channel, Contessa Salvador. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.